I wanted to bring today's episode to the podcast talking about the correlation between your AMH level and the thyroid. We're going to be talking about the studies, what the studies are telling us. We'll be talking about functional reference ranges. Many times you're told your thyroid is normal and you're dealing with ovulation issues, you've had miscarriage, you have irregular cycles, and you have low AMH. And so today's episode is a call to action for you to really take your health into your own hands. There's things you can do. You don't need to wait to go to IVF and pump your body full of hormones. If you have low AMH, let's look at the thyroid and see exactly what we can do to improve your chances of pregnancy success. Let's go. Hey, Katie, excited to have you back on the podcast.
Hey, thanks for being here. Thanks for having me.
We're here again.
Thanks for being here.
Awesome. So today we're digging into the thyroid. I've had many episodes on the thyroid, and so we'll link some of those below. But basically, it is one of the themes that we see with couples that are dealing with low AMH and or high FSH. And today we're going to be talking about some of the studies that will link the thyroid with AMH levels. And it's just something that in conventional medicine, there's a lot of this medical gaslighting where, you have your hair is falling out, you got cold hands and feet, you have ovulation issues, irregular cycles, and maybe your thyroid is at a 3. They're just looking at the TSH and they're like, it's at a 3, but it's normal. Or maybe it's a little bit over 5 and you've been told it's normal, but it's a little high. So we're going to be talking all about why that's just wrong. That thinking does not make sense. It's outdated. And I think some of us know for the fertility journey that your REI may have said we want it below 2 with the TSH, and maybe you'd be giving medication to take it to lower it. So we're looking at a functional nutrition medicine approach with this, and looking at what those levels could mean, why the thyroid is the canary in the coal mine. And it's really, what else is it telling you about your health? And really, as we dig deeper, medication can be part of it, but it by itself it's a Band-Aid approach. And so let's talk about some of the studies here, because we've got some studies actually that are coming out on the correlation between AMH levels and thyroid. And I'll let Katie take us through those.
Yeah, so there's an interesting study from back in 2016, and this was investigating 225 women who were struggling with infertility. And what they were interested in was looking at their TSH levels, right? Because we're thinking about, just like you just said there, Sarah, what levels of TSH are optimal? Like how is TSH impacting fertility, and especially with regards to AMH? Because I think when we're on a fertility journey, and I know lots of people that listen to your podcast, Sarah, are the AMH piece is something that really worries them, and maybe they've been told they've got low AMH or low ovarian reserve and high FSH in this picture, and actually that can really strike panic into you. So this was really interesting because they wanted to explore that link between your TSH. By that we mean the thyroid stimulating hormone, so TSH and AMH specifically. And what they found in this study was that those who had a TSH of less than 3, so this is a TSH of 3 is something that a lot of medical doctors just wouldn't even bat an eyelid on, or 3, 4, 5, 6, sometimes even 7. And actually what they found was that the TSH of below 3 was associated with significantly better ovarian reserve and essentially better, higher AMH than those who had a TSH of above 3. And so this was an observational study that they found, and really this strongly suggests that the effects of lowering TSH levels, whether that's kind of using the holistic approach or using some medicine there too, can be really helpful to actually keep those levels below 3 so that we can improve then that AMH.
Yeah, absolutely. And we see this, with our clients all the time. When we work with them, we see the levels improve, and we're looking at a full thyroid panel. And we're going to give you what those levels are in a minute. And so you can, look at your levels and see what's potentially been missed. And sometimes, your conventional doc's not even going to pull the full panel. So obviously asking for that. And if they don't want to do it, then get a different doctor. And yeah, they're working for you, not the other way around, right? So you know your body best. So we're just, educating and spreading the word here that, to be your own advocate is key. So interesting that the studies here, what we are seeing, with our clients clinically, now the studies are showing the same. So let's talk about the other study we have here.
Yeah, so this was a slightly bigger study. It was a report essentially back in 2022, so quite recent, and it was a meta-analysis and systematic review. So what that means is that it was a big analysis of lots of different trials and bits of research that had already been done. So they were researching nine different studies, and their main findings collectively from analysing the data that's available is that, again, the AMH levels were significantly higher in patients who had euthyroidism, so normal, like regular optimal thyroid markers. So their conclusion that they drew from that is that suboptimal thyroid or hypothyroidism through to suboptimal may affect the ovarian reserve, and that AMH levels, because it's the thyroid issues and a suboptimally functioning thyroid can be implicated in the follicular depletion, so follicles literally deteriorating, right? And so we can do something about that. This is something that the bits of news like this actually give us hope, because they show us that we can do something, because the thyroid is like super responsive. It's an organ that works on a feedback loop in the body, and there's so much that we can do from a nutrition point of view, from a stress point of view, and from if needed, a medical point of view, to actually support that system.
Yeah, we see that all the time too, where people are like, I've done, before coming to see us, they might have had multiple failed IVFs, multiple failed retrievals, failed transfers, being told their egg quality is poor, terrible, and then making these targeted changes. Lo and behold, they decide to either they get pregnant naturally, or if they do need to go to an IVF, then the egg quality, the transfer, people share pictures of babies with me all the time because they've gone through made the changes, and then it worked for them. So, and this is something we talk about in our clinical mastermind too. We meet weekly as a team about the adrenals and the impact of, what that's doing. So the direct connection with the ovaries, if your adrenals are flatlining because you've been going through like IVF after IVF, and the stress and the chronic stress of even getting this diagnosis, people even, I was talking to someone the other day, like being told just, sorry, the AMH is low, it's donor eggs for you, there's nothing you can do, and just very callous and very clinical, right? Maybe the doctor's just telling you the news, here it is, but you're just like blown back and gutted, because that's just like shocking to hear.
Yeah, absolutely. And you touched on a really important point there, Sarah, about those connections with different parts of the body. And really that just wanted to touch on, this is something that we've spoken about in our podcast before, but this concept of the HPA axis. So that stands for the hypothalamic and pituitary glands. That's the HP in the brain. So these are really our listening glands in the brain that listen and monitor what's going on in the rest of the body, and then they shoot out the kind of the directions to all of the different endocrine organs. And so the HP axis and that sits on the same axis. So we talk about that HPA axis when we're thinking about that stress response and that adrenal response, but it sits on the same axis. So I always talk about the HPOAT axis, and that's ovarian, adrenal, and thyroid. And those three systems, those organ systems, they triangulate and they have a knock-on effect on one another. And so we know that a suboptimal thyroid can it can stop you ovulating even, and if you're super stressed, like we know that how many people have you spoken to, Sarah, and listeners who have had an acute stressful life event happen and then they don't ovulate that month, right? And it's because those systems are linked and one drives the other. So the thyroid, you can't really consider the thyroid outside of the context of the ovaries and the adrenals.
Yeah, this is not in a silo, right? All of it connects. And it's like, okay, I'll ask people before they had this diagnosis what was going on. Maybe they were in a stressful job. I can't tell you how many people, either people with low AMH, there's a theme of people doing a lot of vigorous exercise, like jogging, running 30 miles a week, and also finishing off either a master's, a PhD, a second master's, like this, and also doing work and then managing home life. Maybe you already have a child at home as well, managing all this and being like, oh no, I'm totally fine. Well, yeah, something's going on with the adrenals. And then now that's impacted the thyroid, and we have a whole bunch of things going on. And so for that type A, get it done kind of person, which is who we work with, there's things we can do. So as a type A, you're a doer like me, and you're gonna take action. So so we do definitely.
And really, really just important to sneak in there while we're giving that messaging, Sarah, because I know we're talking about this axis in terms of the ovarian side of things, but it is on the testicular side as well, and the gonads and those reproductive organ systems on the male side too. So the men don't escape from this. It's not just about your ovarian function and your AMH. This is about sperm quality and testosterone and all those things that testes are responsible for in males as well. So please don't think that men just get away with this.
Yeah, them having the pizza and beer while you're going gluten-free, making all these changes. Nope, it's doing it together. So we have a couples coaching program to have you both in the best shape as you prepare for your baby. And definitely check out that episode that Katie and I did. We did a deep dive all about male factor fertility issues. Lots to do to improve your semen quality. So when we have a thyroid issue, this can be linked with ovulation disorders, irregular menstrual cycles, and increased risk of miscarriage. What are we seeing there, Katie?
Yeah. So again, like when we're working with someone to prepare for pregnancy, like we're ultimately what we're doing, we're not just trying to prepare the eggs. We're not just trying to, support someone to ovulate. We're not even just trying to support a conception. We're actually trying to support a healthy pregnancy and a baby at the other end of it. And the thyroid impacts all of those things. So the thyroid is associated with miscarriage risk as well. So the thyroid is something that I recommend people get their thyroid checked once every trimester at least, because of the implications with thyroid function and pregnancy loss, right? And I know it's a really difficult thing to talk about. But these are some of the things that we need to be troubleshooting to make sure. And a lot of the time, again, thyroid testing isn't routinely done, certainly in the NHS here in the UK in pregnancy. People aren't checking thyroid as part of pregnancy, as part of your midwifery appointments. So this is really something that you need to take into your own hands, just like part of your MOT, right? And so once you get that like positive pregnancy test, we still need to be thinking about the thyroid, and actually especially we need to be thinking about the thyroid then. So it's everything in terms of that ovarian function, right the way through to actually being able to carry a baby.
Right. So if you've got irregular cycles, no cycles, you don't know if you're ovulating, you've had miscarriage, looking at the thyroid is key. So let's talk about, so many times we were told in conventional medicine that my thyroid was at a 3.5, and I was told it was normal. And I had all these different symptoms of the hair, the cold, the dry skin, the cold hands and feet. And it wasn't normal. And so we're looking for optimal. And many times in conventional medicine, they're like, everything's fine. There's nothing you can do, but something's wrong. We all know our body. Something is obviously happening. If we have irregular cycles, we're not ovulating, we've experienced miscarriage. And so we don't need to wait for the third miscarriage before they do a deep dive into to our health, is to take action now. So let's talk about some of these the full panel, some what to look for, reference ranges. Katie, if you could go.
And I think really importantly there, Sarah, you touch on like some of the symptoms, and even if you haven't had your bloods done yet, if some of the things that you say are triggering thoughts for you as the listener there around, oh, well, I do have like cold extremities and I am really like tired all the time, and I'm finding that my hair is falling out, and right, the brittle nails, the weight gain. Like if you suddenly find that nothing's changed but you're putting on weight, that can be, because thyroid is the metabolism gland, that can be that if you've got a suboptimal thyroid, then it can slow down your metabolism. So if any of those things apply to you, then please do be considering getting your thyroid checked out. And it's not just about, again, we want to look at this as comprehensively as possible. Now, a lot of blood tests here in the UK, I'm sure it's the same elsewhere as well, are you would go to your doctor, ask to get a thyroid screen, and you would come out with your TSH, which is the top level thyroid hormone. But actually, TSH isn't actually a thyroid hormone at all. It's produced by the brain, right? It's produced by the pituitary gland in the brain, and that's the hormone that tells your thyroid to secrete and to produce and secrete thyroid hormone. So TSH is a good indicator of thyroid health at the top level, because it kind of tells us what that what the master overseer is looking at and responding to. So it's a helpful indicator, but it's certainly not the full picture. And we often find sometimes people have like an in range and even in optimal range TSH, but you look further downstream at what the actual thyroid hormones are doing and you find some irregularities. Now, what happens is your thyroid gland will produce T4, thyroxine, and then that will go on to produce T3. And T3 is the active thyroid hormone. That's like the resulting thyroid hormone that works in all of your tissues in your body and actually does its thing. So really, we want to know what all of that cascade is doing, because we can figure out if you've got a normal TSH, but your T4 is suboptimal. We can be thinking about why that might be, right? Do you have the right nutrients in place? So T4 needs iodine, it needs tyrosine, the amino acid, it needs iron. So we might be questioning then, like, oh, okay, what's that person's diet like? Is there enough iron? We might test iron. We might think about their protein intake, right? So we start to troubleshoot. And if someone's T4 is okay, but their T3 is really low, then we're thinking, okay, well, what's going on with that conversion? Like, do they have enough selenium and magnesium and zinc to actually be able to convert into T3 from a nutrient point of view? Or could it be that they're pushing the reverse T3 pathway, which means that they are most likely driven by a stress response? And that's when we're linking back into the adrenals. So knowing your numbers and knowing that different parts of the cascade, what is happening where, can help us to troubleshoot and know where your support best lies. So thinking about numbers then, and optimal ranges, we've spoken about the TSH there. Now, usually between 1 and 2, sometimes 0.5 and 2, just depending on the clinical picture, are good numbers for TSH. Now, I guess important to note here that everything we've alluded to so far is alluding to hypothyroid symptoms and signs, and suboptimal in that way. But of course, the thyroid, is an active thyroid gland, and it can swing. And so we do need to be vigilant for hyperthyroidism as well. And if your TSH is like super low, like less than 0.5, then we need to be questioning that as well and mapping that out along with your symptoms. Are you like, has your metabolism, really sped up? Are you suddenly finding that you're not sleeping? Do you have a racing heart? Do you kind of have this jittery feeling? Those are all signs that are associated with, and weight loss as well, can be associated with hyperthyroidism. And sometimes what can happen is we can swing. So sometimes we can be, if you're like hypothyroid for too long, sometimes you can actually swing the other way, especially if there's autoimmunity involved, which we'll touch on in a minute. You can swing the other way. So it's the kind of thing where we need to keep a really careful eye eye on. So just wanted to note that.
Yeah, so you do want to monitor it. I do have a podcast episode talking all about Graves. So many times we see people dealing with the hyper side of thyroidism, and so we do a deep dive into Graves, and also there's one on Hashimoto's, so kind of more looking at that. But yeah, let's go back to the numbers here.
So numbers. So yes. So ideally, sort of 0.5, maybe 1 and 2. Those are the TSH optimal ranges. And then for T4, so this is called thyroxine. You might see it come up as thyroxine in your blood panel. We're looking at in micrograms per deciliter, which tends to be your neck of the woods over in US and Canada. We're looking at between 6 and 12, basically 6 and 11.9. Those would be the optimal ranges, and if it's measured in nanomoles per liter, which tends to be what we have here in the UK, we're looking at between 77 and 153. So that's sorry, I'm misreading here. That's for total T4. I'm actually going to mainly focus on free T4 today, because the hormones that we're really interested in knowing about and that are commonly tested are the free hormones, and that just means that they're unbound to proteins that might make them inactive. And so we want to know what the free versions are, because that's the form that is available to you. So do excuse me on that. So it's free T4 that we're looking out for, which is your free thyroxine. We're looking at US markers 1.4 to 1.8, and that's nanograms per deciliter, or UK type markers, which is picomoles per liter. We're looking at 18 to 23. So those are the optimal ranges for free T4. So if you're finding that actually you're sitting down there at like a 1 rather than a 1.4, then you might be wondering, like, do I have the nutrients in place? Like, what's going on there that my TSH is okay, but my T4 is not looking so great. And then for your T3, so again, this is your active thyroid hormone, free T3. We're looking at 3.4 to 4.4 picograms per ml, which is your US markers, or 5.2 to 6.7 picomoles per liter, which would be your UK markers. So those are the kind of numbers that we're looking out for there, for those free hormone markers. And really, those are the main ones that we need to concern ourselves with. Apart from, you mentioned there the antibodies, because the antibodies do play a significant picture, because if there is autoimmunity going on, and the two sets of antibodies that we look at in this instance are TPO antibodies and thyroglobulin antibodies, we know that then could be the cause of those irregulations. So yes, we still want to make sure your nutrient intake is sufficient, and yes, we want to support in as best way we can, but we also need to address the fact that there's some autoimmunity going on, and it may be that a slightly different approach is required there.
Exactly. And sometimes those are elevated. Can you just talk about the levels that we're seeing for the TPO and the other one,
the thyroglobulin? Right. Yeah. So I mean, as close to 0 is best, really. Ideally, we don't want them there at all, but anything up to about 10 for the TPO antibodies, and anything below about 20 for the thyroglobulin antibodies. Now, you might be sitting somewhere above that. So it's not, if don't panic if you're sitting at 22, 25 or something, right? Because with autoimmunity, we really need to take the wider context into consideration. And sometimes even we might have someone whose autoantibodies are sitting at 100, but they might be sitting at 100, whereas previously they've been 500. And so actually what we want to know, if there are antibodies stable at present, we really want to know, are they stable? Are those antibodies stable? Because what happens in autoimmunity is we can have flare-ups. So what we want to then be checking for, which then involves more regular testing, is, are you in a flare situation, which can disrupt and dysregulate the thyroid? Or are you in a calming, regulated kind of situation where ideally the antibodies are gradually coming down, or they're at least stable? So just because you have antibodies sitting at 100 Some people, their antibodies can sit 100 and their thyroids are okay, and we can leave it alone and it's all right. But we need to take your personal situation into account.
Yeah, and if you're having issues with egg fertilization, so you're getting those and they're not fertilizing, looking to see if there's autoimmunity in place is a key factor to examine.
100%. Yeah.
Mm-hmm. And so let's talk about the subclinical thyroid. So it's not actually, there's not actually an issue with the thyroid. It's more of the gut and the liver, and we do the medication, but that alone is a Band-Aid, and we need to look, dig deeper. What are the issues with the gut? And this is when we talk in our clinical mastermind as a team every week, like it's literally always about the gut. And then the hierarchy of things, we've got to address the gut issues that then impacts the health of the adrenals, the ovaries, the whole body. Things come back online and impacts egg quality. So let's talk about the subclinical thyroid issues.
Yeah, so really important point there, Sarah, and it's to say, just like with the ovarian function and the adrenal function and the thyroid sitting in the same axis as those, it also links with the other systems in the body, right? Because the thyroid and those brain hormones associated, those overseers that I mentioned, they aren't just monitoring the endocrine hormones, they're monitoring everything, right? And really, this is about our body being in a state of homeostasis. And so the body wants to be within quite narrow margins of like blood glucose levels, of blood pH levels, of our thyroid hormones and our insulin levels. And there's tight margins that our body has for itself in order to stay alive, right? And that's its top priority. Now, if there are imbalances going on in other parts of the body, so yes, you mentioned the liver, imbalances in the liver can drive those thyroid markers up, the TSH up. The gut microbiome as well is a huge one. We always start with the gut in our field. If there's ever any imbalances, the gut is always the first place we start. And that's for a reason. It's not just because we feel like starting with the gut, it's because the gut drives so much of the rest of our health. So if there are imbalances in that gut microbiome and the bugs that live in our gastrointestinal tract, that can impact the thyroid too. And so can dyslipidemia, so cholesterol. So if you have high cholesterol, and how many Americans don't? Sorry, maybe that's a bit of a mean thing to say, but a lot. If we look at proportions, there are a lot of people in the UK as well, but particularly over there that have high cholesterol and imbalanced lipid markers. And this is something that we've spoken about in a podcast before as well, Sarah. But it's all of those things. We need to be questioning all of those things. It's never, okay, the thyroid's off, so we just throw some levothyroxine at it and hope for the best. It's okay, the thyroid is off, maybe or maybe not, some levothyroxine might help. Could be that it helps, and that's okay. I think especially if you've got someone who's preparing for an IVF cycle and the thyroid is way off, then there's a time and a place, and that can be a time and a place where medication can really help to kind of settle things. But we also need to take it within the wider context. We don't just stick the Band-Aid on. The Band-Aid might be helpful, but then we also need to look at what's going on elsewhere.
Yeah, because so the thyroid is the canary in the coal mine. If there's something going on with the thyroid, there's something else going on in the rest of the body, and we can start addressing those different issues. And to me, running off to IVF, we think that's the fast track. The fast track is taking some time in a very targeted manner, using testing to really improve the chances of your fertility. So IVF will push it. And what we see is it doesn't. We see the people with low AMH and high FSH being poor responders, canceled cycles. It doesn't work. The egg won't fertilize. They've got horrible egg quality. We can see this day in and day out. It is heartbreaking. And now there's a massive push for PRP, and then the body's not set up yet. We've got adrenal issues, thyroid issues, and you've gone and woken up the ovaries, but the body, the foundation is not set. So definitely, we'll link to the podcast on the liver. Katie and I have done a deep dive on that one, and also the podcast on the adrenals. Those are two to look at as well. So let's talk about what are some things we can do to optimize the thyroid health. Definitely want to obviously address gut infections. We do stool testing, looking at the DNA of the stool. If you've got an infection, doesn't matter if you're eating the super clean diet, you can't out navigate the infection. You've got to address it. Blood sugar balance, we've got a podcast on that one that we've done as well. So balancing your blood sugar. If you've got poor sleep, feel hangry, mood, sugar cravings, mood imbalance, looking at your blood sugar is key. And getting honest about the mental emotional stress that is highly correlated. And I know for myself with the thyroid, so I'm hypothyroidism as well. And so I had gut infections, I had food sensitivities, and it was, diagnosed with POI at 28, had both my kids with donor eggs. And then years later, discovered all of these health issues. But the mental emotional stress, just because you can do a lot doesn't mean you need to. So it's like, if you're like that overachiever, keep going and you're like, wow, I'm kind of tired or a little bit, it seems a little stressed, just because you can tolerate it more than others. How is that impacting your body? And in this case, how is this serving your fertility? And you may feel like in a panic that you got to go to IVF right away. It is to focus on your health, and that will help you get pregnant naturally. Or when you do go to IVF, you're going to improve the chances of it working. So anything you wanted to say about that, Katie?
Yeah, I think you touched on something really important, Sarah, and this is something that I've been thinking a lot about recently. And there's a theme here around the extractive nature of the world that we live in now. And we can liken this to the way that we treat like modern agriculture. We try to extract as much as we can from the land. Like, this is how we treat the earth, right? We just try to use it, and we use it, and we use it, and we use it, and there's no let up, there's no break, there's no regeneration. We just expect it to keep performing for us. And then we're seeing all of these troubles around the globe now in terms of all everything that we're seeing in nature. And it's the same for our bodies, right? We're expected to just keep going and just push through and perform at work and perform at home and be this good little performing citizen at all times. And it's just give, go, and that is extracting from your body. It's extracting from your reserves mentally and emotionally as well. And it's just deplete. And so by the time you actually come to wanting to have a baby, because lots of us are doing this a bit later in life, we're so depleted. Like, how can we possibly expect our body to give? And then we extract more because we do IVF, and we literally extract, we force those ovaries to produce more eggs, and we extract them, and then we put them back in. And it's all so take. And so I'd urge you listening to this today, like, what can you give back to yourself physically, mentally, emotionally? It all counts. And this is all the things in terms of your thyroid health, is the giving back to yourself. That's what's going to make your thyroid happy. The giving back nutrition, giving back rest, giving back self-care and love, and all of those kind of things. It sounds cheesy, but it's true.
It is to really, put yourself first, put the oxygen mask on first. A lot of times we're working with people in helping professions, people that support others, and they are just burnt out as a teacher, as a healthcare worker, people that are doing those kind of fields. It's just give, and we forget to give to ourselves because we're just serving others. So, and to me, it's like, you can't help you can help more people when you help yourself. And then you're teaching, as your children come along, the same thing for them. Like, you've got to put yourself first, because if mom goes down, the whole family's going down with us. So we need to be happy and have, in a good place. And this is the time right now to mother yourself and parent yourself, and you and your partner, getting in a good place, your relationship, all of this. Cause this, we see all the time that IVF can, the journey of that, the business of IVF can really destroy a relationship and just leave people, feeling exhausted and then with nothing to show for all their effort. And so working on your health is
hard to think about these things, things in these terms when all you want is a baby. But if you cast your mind ahead for a moment and think about actually what it's going to be like to be thrown into motherhood from this state of complete depletion. I mean, I work with people not just in fertility but through pregnancy and into those mothering years, and it's the people that have really struggled with their health to get pregnant who then struggle with their health in pregnancy, who then struggle and like completely burn out once they actually have kids, because it's a lot. And even if that's the thing that you want most in the world, and you crave it and you desire it so much, it still means that coming into it from a place of calmness and repletion, that matters. That makes a difference.
Yeah, and the good news is in 90 days the eggs can renew itself. We see people all the time that have gone through poor egg quality, failed transfers, poor responders before coming to see us. They take the time to work on work on your health in a short period of time. You can see massive change. And take control of this. Don't need to be at the mercy of waiting for someone to tell you that they're going to do the same procedure on you over and over again with IVF, and not changing the protocol. And what protocol is it? And what drugs am I using? No, you're going to look at in this case, you're definitely going to look at look at the thyroid. And if someone won't look at the thyroid, you get a second opinion. You dig deeper. Okay, you want to minimize toxin exposure, so you want to avoid fluoride, your toothpaste. What else is fluoride? So, I'll go to the dentist and I still get fluoride. I'm like, really? So, and our water, obviously, chlorinated water. Sometimes people are like, my thyroid's off, and I swim every day in a chlorinated pool. That's interesting. That can impair your thyroid production, and also when you're in the shower too, just getting a water filter for the shower. And so you've got all those vapors you're inhaling, that can impact your thyroid. Mercury and some other toxins. Anything you want to say about toxins in the thyroid, Katie?
Yeah, again, it's thinking about a glandular system where it is responding to everything else that's in the body. And I love that analogy of the canary in the coal mine. So we're if there's anything that's causing us problems and putting our bodies in perceived danger, like an imbalance of the gut microbes that we spoke about, like an influx of toxins that then it's the liver then that's struggling to actually deal with all of that, then the messaging that our brain is getting back is, hey, there's a load of stuff going down here that's not cool, so we're going to throw the thyroid off to try and cope with it all. So it's all of the above. And it's also, I mean, I mentioned this when I was talking about the markers and what can go wrong at different points, but nutrient deficiencies are really, really important. So we really, if you're looking at your thyroid, we also really need to consider that within the context of an iron panel, because the iron is such an important nutrient for thyroid. But again, we don't just want to throw iron at it, because iron can be toxic, right? So we need to know, what's your iron status? Do you need extra iron? Can we get it through the diet? Do we need to supplement it? We want to know these questions. We don't just say, oh, iron's a thyroid nutrient, I better just load myself up with iron, because that could be dangerous. And the same with iodine. Like iodine is one of the components of T4, so thyroxine. It stands for, it's tyrosine and iodine, thyroxine, and that's again, iodine, really, really important for thyroid function. But if someone's got autoantibodies of the thyroid, then we need to be really cautious about throwing in too much iodine, especially in the supplement form, because that can exacerbate the antibodies. So this is it's about getting the nutrients right, but it's also, and that's balanced diet, great, all of those things, great, but there are things that we really need to consider in the context of you, and this is where the individualized approach is key, because we can't give generic advice here, because we don't know what you're doing, right? And so it's really important to consider the iron, the iodine, the selenium that I mentioned earlier, the vitamin D as well, so checking in your vitamin D status. So all of these things, the thyroid is a complex organ because it's overseeing everything, so we need to treat it as such and not oversimplify it by just whacking a load of just whacking some T4 in and hoping for the best.
And also the food sensitivities. So obviously gluten and thyroid. We've done many episodes on food sensitivities and the importance of doing the elimination diet, taking the top allergens out of the diet, and then systematically reintroducing them. We see a huge correlation between non-celiac gluten sensitivity. So maybe you've done a celiac panel, it's come back, you're fine. You're like, hey, I can have gluten, but maybe for you, it's causing issues. And if you already have, if you already have digestive issues, so bloating, gas, constipation, diarrhea, burping, all that sort of stuff, you already have digestive issues, just count yourself one of the lucky ones because you know for sure there's something going on with that food. Other times people have acne or joint issues or autoimmune issues or mood issues, or in this case, fertility issues. And you're like, well, I have that piece of bread and I feel totally fine. Well, no, what is it actually doing to your body? So taking it out for 60 to 90 days is key. You may not be able to take it out forever, but take it out for a short period of time and really see how that impacts your thyroid, your health, your ovaries, your menstrual cycle, all of it. We see improvements across the board with making those dietary changes. And then the medication, like we talked about, maybe part of the solution, but medication by itself is just a Band-Aid. You've got to get to the reason why it's off to begin with. Katie and I did a podcast on iron. We'll link that one in here as well. Deep dive into iron, everything you need to know about that. And that was one of the top episodes on the podcast last year on Get Pregnant Naturally. So definitely check that out because so many of us are low in iron. It's like, if you've got heavy periods, people are like anemic and dealing with iron issues. And sometimes people have high iron as well, but iron issues for years and maybe feeling fatigued and a whole bunch of stuff. So that can be all correlated. Anything you wanted to say there, Katie?
No, I think you've more or less covered it all there, Sarah, actually.
Yeah. Any final thoughts here on AMH? So if someone's got the low AMH and high FSH, and they don't know if they have a thyroid issue. Yeah, what's your take there?
Just get the bloods done, get a full thyroid panel done, and ideally a full iron panel done as well, and just check them out. Listen back to this podcast, check out the optimal ranges that we've spoken about today. Listen back to the iron podcast and the optimal ranges for those, and really then work from there. If you've got an issue, then maybe you want to work with someone to support you with that, or just use some of the clues that we've given here to help you, right? And take it a step at a time as well, because I think when you're on a fertility journey and we're saying all these things and it's all relevant and you have to do every single thing in the world ever, then that can feel really overwhelming. And so a lot of it is about, okay, what's my next step? I've identified this. What's the single best thing I can do as my next step? And then we build from there. Not, oh my gosh, I need to start tomorrow and just completely overhaul my whole life, and then it lasts 2 days and then you're back because it's too much, right? So we know that doing things that step-by-step way is what makes sustainable change.
Exactly. Having a guide can fast track it, right? People that have gone before you, done it, using testing, being able to take a target approach to this. Sometimes people think IVF is the fast track. This is the fast track, working on your health. That'll either help you get pregnant naturally, or if you go to IVF and your investment that you've put there, you'll have increased success. So awesome. Thanks, Katie, for today's words of wisdom on thyroid, and have a great day, and thank you.
Cheers. Speak soon.